In 1992, Dr. Bud Rose changed the way clinicians practice medicine. When the big book publishers told him they weren't interested in his idea to convert his entire nephrology textbook to a computer-based clinical tool for doctors, Bud did it himself. And it turns out, it wasn't just the book publishers who wondered why he wanted to bother with computers.
I actually had to give a talk to the kidney division at Brigham and Women's Hospital here in Boston. So I went to his office and asked him if he actually had anything on computer, and he said, yeah, let me show you what I have. He was in this little out-of-the-way office at the Brigham, and I went in there and looked at the computer, and really small screen, not very awe-inspiring. And I remember looking at it and thinking, what a complete waste of time this is. I didn't know then that I'd be joining him within a couple of years.
No one saw quite the vision for it. They thought that the ability to answer questions and to maintain such a resource was going to be impossible and was a fool's errand. To Bud's refrain, and he was always undaunted, he would say, well, they can't answer any questions right now.
His real genius was to say, let's not write about a particular disease. Let's think of the specific clinical questions that somebody has, and let's write about those. So it's really thinking about all of those questions that a clinician has, applying the best evidence to answer those questions, and then making very specific recommendations for care. Because what we've learned over the years is that UpToDate is most effective if we're used at the point of care.
UpToDate for nephrology was a hit with clinicians. But could it be expanded to other medical specialties?
People were just so excited that they'd never seen anything that could actually help them in the way that UpToDate could, and was so easy to digest.
We've done this proof of concept in nephrology, but let's take the leap and expand this to other parts of medicine.
And there was endocrinology,
Cardiology,
rheumatology,
pulmonary and critical care,
and there was gastroenterology.
Above all, producing the best medical content meant maintaining the highest level of quality.
Every word that we write in the program, every recommendation that we make has the potential to influence patient care.
Real doctors and other caregivers are interacting with this content and making decisions, and there's real patients who are being affected.
That gives you a tremendous responsibility to make sure you've gotten everything right. We could not do that without the contributions from our editorial team, because they make all of this possible.
After 25 years, UpToDate has expanded from one specialty to 25, and from a handful of authors and editors to over 6,000.
UpToDate topics are accessed about 1 million times every day around the world, and we know that 30% of the time when somebody comes to an UpToDate topic, it actually changes a decision that they were going to make. So we are impacting 300,000 medical decisions every day globally. We set out to do something, and we actually did it.
But what if we can scale up even further than we've done before? What if we could insert some of that content into the workflow, perhaps without necessarily having to ask for it? We finally have that capability. Mobile devices and electronic medical record systems can help us to guide clinicians in an effortless way to the best decisions that they can.
We will always stay true to the core of what has made UpToDate successful, which is the quality of our content. And we will never compromise that moving forward. But the really exciting thing is that we can have an even bigger impact.
We don't sacrifice anything for the quality of the program so that doctors can make the right decisions, and those right decisions lead to better patient outcomes. That's who we are.